Have you ever felt exhausted and felt dismissed because your blood tests came back normal even when you knew something wasn't right? You're told it's aging or depression or that you need more rest. But deep down, you know your body and you know this isn't normal for you. Hi, I'm Dr. Var. I'm a board certified family medicine physician with additional training in functional, integrative, and lifestyle medicine. Let's dive in. When someone comes to us in conventional medicine with fatigue, we often will order the same basic labs, your CBC, which tells us about your blood counts, CMP, which looks at your liver, kidney, sugar, and electrolytes, your TSH in regards to your thyroid, an A1C, and sometimes a B12 and vitamin D. They also may screen for sleep apnea. Now, those tests matter and they rule out some important conditions, but there are also other things that can cause fatigue that we don't typically look at. And that's where people may fall through the cracks. I regularly see patients who are eating well, exercising, sleeping, and doing everything right. Their labs look fine, but their energy is not. And today I'm going to walk you through 5 often overlooked causes of fatigue. Number 1 is low iron. Now, here's what some people don't know. You can have a completely normal hemoglobin and still be iron deficient. Hemoglobin is a parameter that your healthcare provider will look at on your CBC or blood counts to determine if you're anemic or not. They may also look at your hematocrit as well. If that's normal, they say your iron is good because traditionally they only cared about low iron as if you had an anemia. But iron is so important for many other processes in the body, including a cofactor in your mitochondria, your energy producers of your cells. So if you don't have enough iron, then it may not run optimal. Iron is also a vital component to produce your thyroid hormone. You have thyroid receptors on almost every cell of the body. So if you don't make enough thyroid hormone, then you may have problems with energy. And most conventional physicians will only look at TSH and not look at other parameters of your thyroid. Now, if they do check an iron, sometimes they will only check an iron panel, which just looks at your serum iron, your TIBC, and your iron saturation. And you can get clues from that, but if it's normal, it doesn't rule out that you have an iron issue because those levels can fluctuate. And maybe when they happen to check it, it was good. What you really want to get is a ferritin. A ferritin is the actual measure of your iron stores, what's available over a period of days and weeks, not just a snapshot of that particular time. Now, the lab will have a normal ferritin as low as 15, but we are now learning that that is very low, and the lab range doesn't always equal what's clinically optimal. In functional and integrative, we look at levels between 60 and 100. Now, in conventional medicine, they are getting with it and now are recognizing the importance of low iron, even if you don't have an anemia. And I've seen many patients who have super low ferritins without anemia that are actually able to get iron infusions. Now, even the sleep doctors will try to get your ferritin above 75, especially if you have restless leg symptoms. Here's the catch. Ferritin is something called an acute phase reactant. So what this means is that there are certain things that can make it falsely high, particularly if you are sick or you have a high degree of inflammation. If you get your ferritin level drawn, make sure that you are not sick. Otherwise, it may look higher than it normally is, and it may mask that you have a problem. And if your iron is low, then work with your provider to determine if you may need some sort of iron supplementation and to find out why you're low in iron. Number 2 is insulin resistance, even without diabetes. This is changing in conventional medicine, but I still don't see a lot of doctors really paying attention to insulin resistance. They are paying attention to prediabetes. You do not need a diabetes diagnosis to have an energy problem related to blood sugar dysregulation. The metabolic dysregulation starts years, even maybe decades before you actually become diabetic. So the first phase is high insulin. Insulin's job is to take your blood sugar to your cells so that your cells can use it for energy as fuel. When your insulin is chronically elevated, your cells start to become resistant to it. If you become insulin resistant, your cells don't recognize that baseline level of insulin that your pancreas is shooting out. So, in order for insulin to overcome the receptors on the cell, your pancreas has to make more insulin, and then the cell doors open so insulin can put the sugars into your cells to use it for fuel. What happens is some people even have low blood sugars because they have these high insulin levels around that suddenly will drop their blood sugars because their body can still make insulin. And so if your body can still make insulin, you still can control your sugars and you'll get an overshoot to where your sugars will actually drop. So some people get confused because they think, oh, I have hypoglycemia. I don't have any issue with diabetes. But you could, because you might be in that insulin stage where you still are making insulin. So your sugars are controlled and your A1C will actually be normal because the A1C is a measure of your blood sugars, not of your insulin. So you want to ask your healthcare provider to check a fasting insulin. And from a functional medicine standpoint, we like to see your levels under 5. The lab might say under 15 is normal. You can also get a more specific marker. Some labs like Quest have an insulin resistance score. And if not, you can also have your provider calculate a HOMA IR score where they take your fasting insulin and your glucose and they plug it into this calculator and it gives you a number and it should be under 2. If it's over 2, then you are insulin resistant. You can also look at physical signs on your body. If you measure your waist and it's over 35 if you're female, 35 inches that is, or over 40 inches if you're male, then you are likely insulin resistant. You can also take your waist to hip ratio. If your waist to hip ratio is over 0.85 for women or 0.9 for men, then you are likely insulin resistant. Number 3 is HPA axis dysfunction. Back in the day, this might have been called adrenal fatigue, but that is an outdated term, as it is not your adrenals that are getting tired or burned out. It's more that your stress signal between your brain and the adrenals, called the HPA axis, is dysregulated. So cortisol is supposed to follow rhythm. It's supposed to be high in the morning to get you going. You know, it's your fight or flight hormone, so it gets you going. And then through the day, it tapers down. And then at night, it's low so you can sleep. So if you are chronically stressed, this pattern can get disrupted to where your cortisol starts to rise even higher than where it should be in the morning, during the day, and at night. And eventually this pattern can flip to where it's low in the morning, so it's hard to get up. You might feel wired during the day and then you're tired at night, but you still cannot sleep because that cortisol level is up, or you may fall asleep and find yourself waking up at 2 or 3 in the morning. And then eventually some people just get so burned out where they just kind of flatline. And then there are extremes that are looked at in conventional medicine like Cushing's or Addison's. So if you do have cortisol issues, it is important that you rule those out. I have other videos on cortisol. Be sure to check those out. Number 4 are mycotoxins. So these are mold toxins. I'm not talking about just environmental, but also through foods. So it may not even be something that you're inhaling. It may be something that you're eating. Mycotoxins can directly impair your mitochondria, and these are the energy producers of your cells. So if your mitochondrial function is affected, you're going to feel more tired, even if you're sleeping and doing all the right things. Mycotoxins can also contribute to neuroinflammation, which can show up as brain fog, headaches, mood changes, or difficulty concentrating. And this is something I learned myself. I was feeling a little foggy over the last month. My rep from one of the functional medicine tests gave me a discount on a mycotoxin test, so I decided to take it. And I was surprised because it came back positive for certain mold toxins. And it wasn't the environmental kind. It was ones that come from foods, from oats, apples or pears, and from coffee. And I was drinking this highly advertised powdered coffee. I won't say the name, but I really liked it and I really felt it helped my focus because it had lion's mane, but I don't want to have mold toxin either. So I got rid of that. And I was eating more pears and apples and oats. And so that was a little disheartening because sometimes when you're doing healthy things, you're just like, well, what the heck do I do? Everything is dangerous, right? You feel like that. But there are certain foods that might have a higher propensity for mold than others. And even though I'm exposed to it, if you're detoxing well, it may not necessarily matter, but that's hard to tell. So I just decided to do a GI detox and I actually felt better. I think it was affecting me and I didn't realize it. I'll test myself again after I get through my detox and see if the mold's gone or if I still have it. And of course, you have to avoid the things that are causing you to have mold in the first place. Number 5 is gut inflammation. Did you know that 70% of your immune system lives in your gut? And that's not coincidence. Your gut is one of the few places in your body where the outside world, foods that we eat, microbes, environmental toxins come into direct contact with your internal system. So it makes sense that your body set up the immune defenses in your gut lining. But here's what most people don't realize. Running your immune system is expensive. It takes a tremendous amount of energy, and every time your immune system gets activated, whether it's from an infection, gut irritation, or even certain food reactions, it pulls resources and energy away from your other systems, including your brain, your muscles, and your hormones. And when that immune activation becomes chronic, it creates something called low-grade inflammation. So this is a slow, steady burn that quietly drains your energy reserves day after day. So what causes that inflammation in the first place? Things like poor diet, chronic stress, environmental toxins, or an imbalanced gut microbiome or digestive insufficiency can all start to cause issues with the lining of your gut. Your gut lining is one cell layer thick and it has a mucus layer on top. And if that mucus layer gets degraded, then you can be at risk for leaky gut. So things that should stay inside your gut, like bacterial fragments, endotoxins, can slip into your bloodstream, and then your immune system sees these as foreign invaders and it mounts an immune response, releasing inflammatory chemicals called cytokines. If you're chronically doing this, then you're going to have chronic inflammation that's going to affect not only your gut, but other parts of your body, including your brain, lowering your energy. I have other videos on gut health for more information. So there you have it, 5 reasons that are often overlooked as a cause of fatigue. This is not a complete list. There are other things that we look at from a functional integrative lens, but I just wanted to give you the common things that I look for. The other point I wanted to make is sometimes it's not just a single cause. There could be more than one thing. So if, for example, if your thyroid is off and you fix it and you're taking medicine, but you still don't feel good, you might need to look at your adrenals, your mitochondrial health. All right. I hope this video was helpful. Thank you for listening. If you're listening to the podcast or watching, if you're watching the YouTube video, don't forget to check the descriptions. There's some free downloadables. Have a fantastic day.